Question 1. A 45-year-old male presents with confirmed acute HIV infection. He is experiencing an associated HIV-related Kaposi's sarcoma of the skin. What is the correct primary diagnosis code for this encounter? I. B20, C46, 0. B. B20, C. A50, 0. C46, 0. D. C46, 0. B20. Answer I. B20, C46, 0. The concept tested here is the correct sequencing of HIV-related conditions according to ICD-10-CM Guidelines. The keyword confirmed acute HIV infection indicates an active symptomatic HIV disease. For all encounters involving HIV, the code B20, a human immunodeficiency virus, HIV disease, is always sequenced first, followed by codes for any associated HIV-related conditions, such as Kaposi's sarcoma. Therefore, B20 is listed as the primary diagnosis, followed by C46, 0 for Kaposi's sarcoma of the skin. Always remember that B20 takes precedence over all other codes when a patient has an HIV-related illness. Question 2. A patient is diagnosed with methicillin-susceptible Staphylococcus aureus, MSA, pneumonia. What is the correct code for this condition? I. J15-212. B. J15-9. B95-6. C. J15-20. D. J15-29. Answer I. J15-212. This question tests your ability to code a specific bacterial pneumonia with known organism sensitivity. The keywords MSSA pneumonia point directly to a specific bacterial cause and its susceptibility. J15-212 is the precise code for pneumonia due to methicillin-susceptible Staphylococcus aureus, indicating both the infection site and the specific, susceptible organism. Using a less specific code like J15-20 would be incorrect because the organism's susceptibility is known. Always try to code to the highest level of specificity available in the ICD-10-CM codebook. Question 3. A 6-month-old infant is admitted with respiratory syncytial virus, RSV, bronchiolitis. What is the correct diagnosis code? I. J21, 0. B. B97, 4. C. J29. D. J21, 9. Answer I. J21, 0. This question assesses your knowledge of specific viral respiratory infections in infants. The keywords respiratory syncytial virus, RSV, bronchiolitis indicate a definitive diagnosis of bronchiolitis caused by RSV. J21-0 is the specific ICD-10-CM code for acute bronchiolitis due to respiratory syncytial virus, capturing both the type of infection and the causative agent. J21-9 would be too general, and B97-4 is only for RSV as the cause of diseases classified elsewhere, not for the primary condition itself. When the specific viral agent is identified and linked to the condition, always use the most precise combination code. Question 4. A patient is diagnosed with infectious mononucleosis with an associated splenitis. What are the correct codes? I. B2790, D73-3. B. B2710, D73-3. C. B2700, D73-3. D. B2790. Answer C. B2700, D73-3. This question tests the coding of infectious mononucleosis and its associated manifestations. The keywords infectious mononucleosis with an associated splenitis indicate the primary infection and a specific complication. B2700 is the correct code for gamma-herpes viral mononucleosis, which is the most common form of infectious mononucleosis, and D73-3 is the code for splenitis, which is an inflammation of the spleen. You should always sequence the infectious mononucleosis first, as it is the underlying cause, followed by the code for the splenitis. Remember to look for combination codes or code first / use additional code notes when an infection has related manifestations. Question 5. A patient presents with a history of latent tuberculosis, B, infection, and is currently asymptomatic. They are being evaluated for treatment. What is the correct code? I. A 15-9. B. A 16-9. C. A 15-5. D. A 15-7. Answer C. A 15-5. This question focuses on coding asymptomatic or latent tuberculosis. The keywords latent tuberculosis, B, infection, and asymptomatic are crucial here. A 15-5 specifically represents latent tuberculosis, meaning the patient carries the TB bacteria but does not have active disease symptoms. This distinguishes it from active forms of TB A15X or A16X, where the patient is symptomatic. When coding latent conditions, ensure you select the code that clearly states latent or asymptomatic to reflect the patient's current disease state accurately. Question 6. A patient is admitted to the hospital with sepsis due to a confirmed urinary tract infection, UTI. The physician notes severe sepsis with septic shock. What is the correct primary diagnosis code? S. I. R65, 21, and 39, 0. A41-9. B. A 41-9 R65, 21, and 39, 0. C. N39, 0. A41-9 R65, 21. D. R65, 21, and 39, 0. Answer I. R65, 21, and 39, 0. A41-9. This question tests the complex sequencing rules for severe sepsis with septic shock. The keywords sepsis due to a confirmed urinary tract infection, UTI, severe sepsis, and septic shock are all critical. According to ICD-10-CM Guidelines, when severe sepsis is present with septic shock, R65, 21, severe sepsis with septic shock must be sequenced first. This is followed by the code for the underlying systemic infection, A41-9, sepsis, unspecified organism, and then the code for the localized infection, N39-0, urinary tract infection, site not specified E. Remember the specific guideline that places R65-21 as the principal diagnosis when septic shock is documented with severe sepsis. Question 7. An outpatient presents for an HIV test, worried about a recent exposure. The test results are negative. What is the correct code for this encounter? I. Z11-4. B. Z26. C. B20. D. R75. Answer I. Z11-4. This question tests the proper use of Z codes for screening encounters related to infectious diseases. The keywords outpatient, HIV test, worried about a recent exposure, and test results are negative confirm that this is a screening encounter. Z11-4 is the correct code for an encounter for screening for human immunodeficiency virus, HIV, as the patient is being tested without a current diagnosis of HIV, and the results are negative. It's important to distinguish screening Z11X from actual exposure, Z26, or indeterminate results, R75. Always use a screening code when the primary reason for the visit is to test for a disease in the absence of symptoms or known positive status. Question 8. A patient is diagnosed with herpes simplex keratitis. Which of the following is the correct code? I. B0051. B. B0050. C. B009. D. H1989. Answer I. B0051. This question assesses your ability to code a specific viral infection affecting a particular body part. The keywords herpes simplex keratitis indicate a herpes simplex infection impacting the cornea of the eye. B0051 is the precise ICD-10-CM code for herpes viral keratitis, clearly identifying both the viral agent and the affected anatomical site. Using a general code like B009, herpes viral infection, unspecified E, would be incorrect as more specific information is available. Always aim for the highest level of specificity that accurately describes the documented condition. Question 9. A patient is a known carrier of typhoid fever, but is currently asymptomatic and not receiving treatment. Which code is most appropriate? I. A010. B. Z221. C. B99. D. Z111. Answer B. Z221. This question focuses on coding a carrier state for an infectious disease. The keywords known carrier of typhoid fever and asymptomatic are key indicators. Z221 is the appropriate code for a carrier of infectious disease, specifically a carrier of typhoid. A010 would be for an active typhoid fever infection, which is not the case here. When a patient is documented as a carrier of an infectious disease without active symptoms, always select AZ22X code. Question 10. A patient presents with acute viral hepatitis B with delta agent and hepatic coma. Which codes are appropriate? I. B16-0, K72-90. B. B16-0. C. B16-9, K72-90. D. B17-0, K72-90. Answer I. B16-0, K72-90. This question tests the coding of specific types of viral hepatitis and associated complications. The keywords acute viral hepatitis B with delta agent and hepatic coma provide the necessary details. B16-0 is the specific code for acute hepatitis B with delta agent with hepatic coma. This code already includes the hepatic coma, which is a key complication. However, ICD-10-CM Guidelines also state to use additional code for hepatic coma, K72-90, when coding viral hepatitis with delta agent. So, B16-0 is the correct primary code, followed by K72-90 to fully describe the hepatic coma, even though it's implied in the B16-0 description as per the instruction. This is an exception where an additional code note overrides the initial thought that the complication is already fully captured. Question 11. An 8-year-old child presents with a documented case of chickenpox, varicella, and is developing post-herpetic neuralgia. How should this be coded? I. B019, G53. B. B019, G53, 0. C. B019. D. G53, 0. B019. Answer B. B019, G53, 0. This question assesses the coding of an acute infection and its associated neurological sequela. The keywords chickenpox, varicella, and developing post-herpetic neuralgia are crucial. B019 is the correct code for varicella chickenpox, which is the underlying cause. G53-0 is the specific code for post-herpetic neuralgia that occurs in diseases classified elsewhere. For sequelae of infectious and parasitic diseases, the code for the acute infection is typically sequenced first, followed by the code for the specific sequela. This guideline ensures the primary cause, chickenpox, is noted before the resulting neurological condition. Question 12. A patient is diagnosed with pneumonia due to Klebsiella pneumoniae. Which is the most appropriate code? I. J15-0. B. J15-9. B96-1. C. J15-4. D. J18-9. Answer C. J15-4. This question tests the specificity in coding bacterial pneumonia. The keyword Klebsiella pneumoniae is a specific bacterial organism causing the pneumonia. J15-4 is the precise ICD-10-CM code for pneumonia due to Klebsiella pneumoniae, directly identifying the causative agent. While B96-1 is the code for Klebsiella pneumoniae as a cause of diseases classified elsewhere, it should not be used in addition to J15-4 as J15-4 already includes the organism. Always select the single combination code when available, rather than a less specific pneumonia code plus a bacterium code. Question 13. A patient is treated for Rocky Mountain spotted fever. What is the correct diagnosis code? I. A77-4. B. A 77-9. C. A 77-0. D. A 77-1. Answer I. A 77-4. This question asks for the correct code for a specific rickettsial infection. The keyword Rocky Mountain spotted fever directly points to a precise diagnosis within the infectious diseases chapter. A 77-4 is the specific ICD-10-CM code for Rocky Mountain spotted fever, which is a type of rickettsiosis. It is important to know the specific codes for commonly encountered infectious diseases. Always use the most specific code available in the classification. Question 14. A patient is admitted with septicemia due to an indwelling central venous catheter, which is also infected. The organism is not yet identified. What is the correct coding sequence? I. T80-211A A41-9. B. A 41-9 T80-211A. C. A 41-9 T80-218A. D. T80-218A A41-9. Answer D. T80-218A A41-9. This question assesses the sequencing of complications of medical devices with associated infections. The keywords septicemia due to an indwelling central venous catheter and infected are crucial. According to ICD-10-CM Guidelines, when an infection of an indwelling device T80-218A for other infection due to central venous catheter leads to a systemic infection like septicemia, A41-9 for sepsis, unspecified organism, the complication of the device is coded first, followed by the infection. The code T80-218A specifically covers the infection of the catheter causing the issue. Always remember to prioritize the complication code when an infection arises directly from an indwelling device. Question 15. A patient has bacterial meningitis due to Streptococcus pneumoniae. What is the correct primary diagnosis code? I. G001, B95-4, B. G002, C. G000, D. A 39-0. Answer C. G000. This question tests the coding of specific bacterial meningitis. The keywords bacterial meningitis and Streptococcus pneumoniae provide the necessary detail for a precise code. G000 is the specific ICD-10-CM code for streptococcal meningitis, which includes meningitis caused by Streptococcus pneumoniae. Using G001 pneumococcal meningitis would also be technically correct, but G000 is broader and Streptococcus pneumoniae falls under it. When a specific bacterial organism is identified as the cause of meningitis, look for a combination code that includes both the condition and the organism. Question 16. A patient is undergoing treatment for active pulmonary tuberculosis with cavitation. What is the correct code? I. A 15-0. B. A 15-3. C. A 16-2. D. A 16-0. Answer B. A 15-3. This question focuses on specific types of active pulmonary tuberculosis. The keywords active pulmonary tuberculosis and with cavitation are important details. A 15-3 is the precise ICD-10-CM code for tuberculosis of lung, with cavitation, accurately describing the specific form of the disease. A 15-0 describes tuberculosis with positive bacteriological findings but without cavitation. Always pay close attention to the presence or absence of specific descriptors like cavitation when selecting tuberculosis codes. Question 17. A patient is diagnosed with mumps with associated meningitis. What are the correct codes? I. B26-1, G020, B. B26-0, C. B26-0, G020, D. B26-9, G020. Answer I. B26-1, G020. This question involves coding an infectious disease with a specific neurological complication. The keywords mumps and associated meningitis indicate the primary infection and a related complication. B26.1 is the specific code for mumps meningitis, which is the primary condition here. G020 is then used as an additional code for meningitis in viral diseases classified elsewhere, specifically to provide further detail about the meningitis. Therefore, B26.1 is listed first as the specific mumps complication affecting the meninges, and then G020 is added to clarify the meningitis component. Question 18. A 3-year-old child presents with hand, foot, and mouth disease. What is the correct code? I. B084. B. B089. C. B079. D. B09. Answer I. B084. This question asks for the specific code for a common pediatric viral infection. The keywords hand, foot, and mouth disease clearly identify the diagnosis. B084 is the precise ICD-10-CM code for hand, foot, and mouth disease. Codes like B089 other specified viral infections characterized by skin and mucous membrane lesions, unspecified E, or B09 unspecified viral infection characterized by skin and mucous membrane lesions would be too general when a specific diagnosis is known. When a precise diagnosis is available, always use the most specific code. Question 19. A patient is diagnosed with candidiasis of the skin and nails. What are the correct codes? I. B37-2, B37-0, B. B37-2, B37-81, C. B37-0, B37-2, D. B37-9. Answer C. B37-0, B37-2. This question tests your ability to code multiple sites of a fungal infection. The keywords candidiasis of the skin and nails indicate 2 distinct sites of a candida infection. B37-0 is the specific code for candidiasis of skin and nails, and B37-2 is the specific code for candidiasis of skin and nails. Since both sites are mentioned, you would code B37-0 for cutaneous candidiasis and B37-2 for candidal onychomycosis. When an infection affects multiple sites and there isn't a single combination code for all of them, you should code each site separately. Question 20. A patient is diagnosed with toxoplasmosis with chorioretinitis. What is the correct diagnosis code? I. B58-9. B. B58-0. C. B58-1. D. H32-0. Answer B. B58-0. This question tests the coding of a parasitic infection with a specific organ manifestation. The keywords toxoplasmosis with chorioretinitis point to a specific form of toxoplasmosis. B58-0 is the precise ICD-10-CM code for toxoplasma chorioretinopathy, which directly identifies toxoplasmosis affecting the choroid and retina of the eye. Coding B58-9, toxoplasmosis unspecified E, would be too general given the detailed information. When a specific organ involvement is documented with a parasitic infection, look for a combination code that includes both the organism and the affected site. Question 21. A patient presents with a fever of unknown origin and a tentative diagnosis of viral infection. The physician orders further tests. What is the most appropriate code for this outpatient visit? I. R50-9 B34-9 B. B34-9 R50-9 C. B34-9 D. R50-9. Answer D. R59. This question evaluates the coding guidelines for unconfirmed diagnoses in an outpatient setting. The keywords fever of unknown origin and tentative diagnosis of viral infection are critical. In an outpatient setting, if a definitive diagnosis has not been established, it is inappropriate to code the tentative viral infection. Instead, you should code the signs and symptoms. R59 is the correct code for fever unspecified. Avoid coding diagnoses that are not yet confirmed in outpatient scenarios. Always go with the documented signs, symptoms, or abnormal findings until a definitive diagnosis is made. Question 22. A patient has influenza with pneumonia. The specific influenza virus has not been identified. What is the correct code? I. J10-0. B. J11-0. C. J11-1. D. J10-1. Answer B. J11-0. This question focuses on coding influenza with pneumonia when the specific viral strain is unknown. The keywords influenza with pneumonia and specific influenza virus has not been identified are key. J11-0 is the correct ICD-10-CM code for influenza with pneumonia, virus not identified. If the specific virus, e.g., H1N1 avian influenzae, were identified, then a J10X code would be used. When coding influenza, always check for documentation of the specific viral strain. If it's not present, use the unspecified codes in the J11 series. Question 23. A patient is diagnosed with dengue fever with warning signs. What is the correct code? I. A 90. B. A 91. C. A 92-0. D. A 97-0. Answer I. A 90. This question tests your knowledge of specific arboviral fevers and their variations. The keywords dengue fever with warning signs directly indicate the appropriate code. A 90 is the specific ICD-10-CM code for dengue fever with warning signs, distinguishing it from dengue fever without warning signs, A91. It's essential to be precise with codes that offer levels of severity or specific manifestations, like the presence of warning signs in dengue fever. Always look for the most specific code that describes the condition, including its clinical features. Question 24. A patient is diagnosed with acquired absence of spleen due to sepsis following a prior splenectomy. What is the correct primary diagnosis code? I. D73-3. B. D73-5. C. A 41-9. D. Z90-81. Answer B. D73-5. This question tests the coding of conditions related to splenectomy and subsequent conditions. The keywords acquired absence of spleen and due to sepsis following a prior splenectomy are important. D73-5 is the correct ICD-10-CM code for acquired absence of spleen, which is the direct result of a splenectomy. While the patient may have had sepsis previously, the current diagnosis is about the missing spleen, not the active sepsis. The code Z90-81, acquired absence of other, part of, endocrine gland and other organs, could be considered, but D73-5 is more specific to the spleen. Always code the current condition that is the focus of the encounter, even if it's a sequela of a prior event. Question 25. An elderly patient presents with a cellulitis of the left lower leg due to community-acquired parasitic. What is the correct coding sequence? I. L03-116, B95-62. B. L03-116, B95-61. C. L03-116, B95-6. D. L03-116. Answer B. L03-116, B95-61. This question tests the coding of a skin infection with a specific drug-resistant organism. The keywords cellulitis of the left lower leg and community-acquired MRSA are crucial. L03-116 is the correct code for cellulitis of the left lower limb. According to ICD-10-CM guidelines, when documenting an infection caused by methicillin-resistant Staphylococcus aureus (MRSA), an additional code from category B95, Streptococcus, Staphylococcus, and Enterococcus as the cause of diseases classified elsewhere, or B96, other bacterial agents as the cause of diseases classified elsewhere, should be used to identify the infectious agent. B95-61 is the code for methicillin-resistant Staphylococcus aureus infection as the cause of diseases classified elsewhere. Always remember to use an additional code to identify the MRSA organism when coding MRSA infections. Question 26. A patient is diagnosed with human papillomavirus, HPV, infection of the vulva. What is the correct code? I. A 63-8. B. B97-7. C. B97-7 and 76-0. D. A 63-0. Answer D. A 63-0. This question focuses on coding a specific sexually transmitted infection affecting a particular anatomical site. The keywords human papillomavirus, HPV, infection, and vulva indicate a specific diagnosis. A 63-0 is the precise ICD-10-CM code for anogenital venereal warts, which are typically caused by HPV and affect areas like the vulva. While B97-7 is for HPV as the cause of diseases classified elsewhere, A63-0 is a combination code that already specifies the HPV-related anogenital warts. Always opt for the specific combination code when available, rather than a less specific code plus an organism code. Question 27. A patient presents with acute bacterial gastroenteritis due to Clostridium difficile. What is the correct code? I. A 047. B. A 048. C. A 090. D. K529. Answer I. A 047. This question assesses the coding of specific bacterial intestinal infections. The keywords acute bacterial gastroenteritis and Clostridium difficile pinpoint the exact diagnosis. A 047 is the specific ICD-10-CM code for enterocolitis due to Clostridium difficile, which is the most accurate representation of this condition. Using a general code like a 090, infectious gastroenteritis and colitis, unspecified D, would be incorrect because the specific causative organism is known. Always select the most specific code that identifies both the infection and its causative agent. Question 28. A patient is diagnosed with cryptococcal meningitis. What is the correct code? I. G021. B. B37-5. C. 18-8. D. B45-1. Answer D. B45-1. This question tests your knowledge of specific fungal infections and their manifestations. The keywords cryptococcal meningitis directly identify a fungal infection, cryptococcosis, affecting the meninges. B45-1 is the precise ICD-10-CM code for cryptococcal meningitis, which is a specific form of cryptococcosis. G021 refers to meningitis and other fungal diseases, but B45-1 is a more direct combination code. Always choose the most specific combination code available for fungal infections with specific organ involvement. Question 29. A patient is diagnosed with sepsis due to Escherichia coli and is experiencing acute kidney injury. The physician does not document severe sepsis. What is the correct coding sequence? I. A 41, 51, N17-9. B. N17-9. A 41, 51. C. A 41-9. B96, 20 and 17-9. D. A 41, 51. Answer I. A 41, 51 and 17-9. This question focuses on coding sepsis with an associated organ dysfunction when severe sepsis is not documented. The keywords sepsis due to Escherichia coli and acute kidney injury are key, along with physician does not document severe sepsis. When sepsis is documented, and there is an associated acute organ dysfunction without documentation of severe sepsis, the code for the sepsis, A41-51 for sepsis due to Escherichia coli, is sequenced first, followed by the code for the acute organ dysfunction, and 17-9 for acute kidney failure, unspecified E. Remember that a clinical diagnosis of severe sepsis must be explicitly documented by the provider to use an R65-2X code. Question 30. A patient has congenital cytomegaloviral disease with retinitis. What is the correct primary diagnosis code? I. P35-1. B. P35-1. H32-0. C. B25-0. D. P35-0. Answer I. P35-1. This question involves coding a congenital infectious disease with a specific manifestation. The keywords congenital cytomegaloviral disease and with retinitis are crucial. P35-1 is the correct ICD-10-CM code for congenital cytomegaloviral retinitis. This code specifically captures both the congenital nature of the infection and the associated retinitis. Although B25-0 is for cytomegaloviral pneumonitis, it doesn't describe the congenital aspect or the retinitis. Always select the most specific code that fully describes the congenital condition and its identified manifestation.